Okay, good morning, everyone. Welcome to our webinar this morning. Thank you very much for taking time out of your morning to join us. I'll just quickly introduce myself. I'm Jade Hagan, Chief of Staff here at the International Center for Sustainability. The International Center for Sustainability is a think tank. We are we focus on fostering a deeper relationship between the United Kingdom and India, with sustainability at the heart of everything that we do. We focus on producing research, learning, we provide learning and development, and we also influence policy through our research, both at a corporate and at a government level. One of the verticals that we focus on here at the center is preventative health, and it is for that reason that we are hosting this webinar this morning. A few very quick household matters. This event is being recorded. You'll be able to find it on our YouTube channel, which we're launching very soon, as well as on our website. Feel free to post on social media if you like. You can find the International Center for Sustainability on LinkedIn. During the event, the mics will be on mute, and we invite you to please share any questions you might have that you would like to post to the speakers in the Q&A. 3 of these questions will be selected at the end, and both Sarah and Rina will be discussing these. Without further ado, let me introduce our esteemed speakers. We have Dr. Sarah Hughes with us this morning. Sarah is CEO of Mind. She's had a very celebrated career for over 35 years in mental health and social justice. Sarah regularly appears in the media and is called upon by governments and private companies across the world to comment and share her knowledge on mental health matters. Sarah holds a professional doctorate on women and leadership. And she also holds an honorary doctorate that she received last year from the University of Hull, where she previously studied social work as a student. And I'd also like to introduce our next speaker, Professor Rina Arya, to our audience. Professor Arya is a critical and cultural theory professor at the University of Hull. Rina works on a number of interdisciplinary subjects. Recently, her 2 major focus areas are decolonization and cultural appropriation. Last year, Rina has had a book published by Cambridge University Press. It's titled Journey to the Center of the Self, exploring the lived experiences of South Asian psychiatrists in the United Kingdom. We'll be sharing a link to that book at the end if you'd like to purchase it with a discount code. Rina is also a fellow here at the International Center for Sustainability. Allow me to introduce our topic. You all know because you signed up to it and you have been interested in it, hence your attendance. Our speakers will be looking at mental health in a post-COVID world and many of the issues that have arisen out of that and how these are being addressed. So with that, I hand over the floor to our esteemed speakers.
Thank you very much, Jade, for the warm introductions, and also to the Centre for hosting this really important event. I'm delighted to be having this conversation with Sarah. Mental health is very important to me, Sarah, on a personal level and also in terms of my professional roles as an educator and university manager. I've directly seen mental health in the student population decline since COVID, and the ways it's manifested is in greater levels of anxiety and depression, which has impacted attendance, participation, and the retention of students as well. The pattern is really seen across the board. And I'd be interested to explore this in our conversation and to learn how your organisation Mind approaches mental health and how in particular it's dealt with mental health in a post-COVID world. But to start off with, Sarah, it would be really helpful if we could learn more about your journey into mental health. So I understand you studied social work at the University of Hull. Can you talk more about this and also address when you actually developed an interest in mental health?
Oh, Rina, thank you so much. And I really feel very deeply that sort of experience of decline in students, and we will definitely come back to it, and let's do that. So yeah, it's interesting that the notion of when kind of the thoughts around mental health came into my mind as something I wanted to do as a career, because in many respects I grew up in an environment where people that I loved very much had very difficult experiences with their mental health. So, you know, I came from a family of people who had immigrated to the UK, and therefore there was all sorts of racism and discrimination that they experienced. You know, and all sorts of other factors. We lived in poverty, which also meant that, you know, we struggled a lot, and, you know, homelessness and so on and so forth. So mental health and mental illness was always something that I kind of knew and understood. And then when I was 15, and we lived in Finsbury Park in North London, and my dad was a community activist, and he worked with Jeremy Corbyn and developed one of the first housing cooperatives in London, if not in England at the time, in the mid-70s. And so I grew up with this sense of activism. I grew up with this sense of, you know, I knew people experienced mental illness. My dad got me a job in the local residential home for people with mental illness when I was 15 as the events coordinator. So it kind of was my life. And then when I was deciding about what to do, you know, at university, and I was the first person in my family to go to university, social work seemed like the natural direction. You know, I knew it. I'd already been working in the space, so it felt very comfortable for me. It felt like coming home. I did have a second option, which was going into archaeology, but I mean, mental health won ultimately, and I'm glad it did.
Thank you for that introduction, and it sounds like a lot of the people that you were surrounded by and really motivated your interest into kind of mental health, especially activism. So when you started with your activist work, then how did that kind of journey develop into joining Mind? Can you take us through the main trajectory? Thank you.
I mean, gosh, Rina, that's Mind is. So look, I'm a Mind person through and through. And the reason being is that, again, when I was 18, I got my first job at Haringey Mind. And I remember walking into the organisation and feeling like I had come home. And the reason I say that is because Mind fundamentally is a campaigning organisation. You know, we're lobbyists, but at the heart of it is our deep care and commitment to people with mental illness. And so I saw at Mind in Haringey a really extraordinary, not just kind of set of services that people were accessing, but a way of being, a way of thinking of mental health, which was, you know, first and foremost, everybody has mental health. And that was really clear. Also that, you know, you can have the most serious mental illness, but that you still have a right to a thriving life, that mental illness should not mean that you have no opportunity or that you're excluded. So there was a huge values alignment with me and Mind. And when I was 18 and I'd gone into this organisation, Mind is quite a complicated beast. So we're a federation, which means there's national Mind, and then there's 105 local minds which deliver services around the country, and we have 180 shops. But it's quite difficult to explain how all of that works to certainly an 18-year-old at the time. But my boss was trying to explain it. And she said, so there's a sort of mothership. There's a Mind mothership. And there is a whole, you know, there's a chief exec there, and they decide kind of how the federation works. And I remember when I was 18 saying to her at the time, I want to be chief exec of the mothership. And all my life, and it's not an exaggeration to say, when I tell people this story, they often find it quite hard to believe, but I absolutely, for the last 30 years, believed I would become chief executive of Mind. And it did take me 30 years, but I'm here now and I'm very happy I am. And it's because I feel really strongly in this kind of notion of justice in mental health, which we haven't got to yet.
So when you joined Mind, then what would you say kind of it was chiefly about then, and how has it changed? So looking at where you are now, Sarah, as the CEO, what's your vision? So if we can talk a little bit about then and where we are now, that would be really good.
I mean, look, when I first started in mental health, it was probably, you know, there was no way we wouldn't be having this conversation for sure. So, you know, in the early 90s when I was starting out, absolutely no conversation about mental health publicly. There was you know, the stigma around mental health was so, you know, it was kind of immersed in our very culture. And of course, services were very hived off. So there was no integration. There was no sense of physical mental health or parity of esteem. People with mental illness were viewed as dangerous. And I'll come back to that because we're kind of going back to that moment. So, you know, people with mental illness were considered dangerous, that if you had mild to moderate conditions or more common experiences of anxiety and depression, you were considered to be weak. And I can see that we have, and at the time we were also working from a position of the long stay psychiatric hospitals were starting to close. And so we were receiving people into the community who had been in hospital for, you know, up to 60, 70 years, some people that I'd worked with. I mean, I worked with a woman called Irene who had been taken into psychiatric hospital when she was 13 years old. When I met her, she was 70. And when we discovered her notes from the archive, she had been admitted to psychiatric hospital then for being precocious. And then she ended up staying in hospital for 57 years. And this is the kind of thing, this is our history. This is where we're coming from. You know, this is a place where people with mental illness were brutalized within the system. Mind had also featured in quite a lot of the kind of activism. So we'd done things like, you know, we'd led some of those campaigns. We'd done things like got people admitted to psychiatric units so that we could reveal the very desperate state of psychiatric hospitals. So we were involved in that big seismic shift and have been ever since. And Mind has led the awareness campaigns across the UK to improve the literacy around mental health. So I can see that, you know, on many levels that we've grown and developed and evolved as a country. Would I say that services are hugely better? I think sometimes, but not always. And so the progress in mental health is probably the slowest in any aspect or any other health domain. So for instance, you know, we are still using the same drugs that we used in the 60s. We're still using the same diagnostic criteria in many respects. So there's all sorts of things that have not changed. And I'm afraid that what we're seeing now, and our evidence at Mind speaks to this, is we're having a little bit of a circle back to, you know, mental health being a bit of a culture war football, if you like. And, you know, we're hearing, Wes Streeting said on Sunday, we think there's an overdiagnosis. We've got other narratives that say people with serious mental illness are violent and dangerous. So some of those narratives creep back in, which speaks to the fragility of progress.
Brilliant, thank you. So it sounds like in some ways we've made progress with mental health literacy, but there's still kind of, you know, prevailing issues. And if I may talk for a moment about my own kind of first encounter with Mind, because what struck me straight away, Sarah, was that what it stood for. I mean, what you said about demythologizing mental health and just acknowledging that we all have mental health, don't we? And that was apparent. And also this notion of mental health conditions being embodied in real life experience. So rather than thinking of, say, diagnostic criteria, what more in terms of what does it feel like to live with a particular mental health condition, the approach, the lived experience, that's more widespread now in mental health discourse. But I think Mind was ahead of the curve there. You know, it really did focus on, you know, people's individual narratives of what it feels like to, you know, to have that. So what do you think? We'll talk more about Mind and what it stands for and what your work is, what you're hoping to achieve ongoing with Mind. But what do you think the main approaches to mental health in the UK are at the moment?
I think that's a great question, and thank you for asking it. I mean, I think that we've got a little bit of a... So what we saw over the last 15 years through austerity is much of the stuff that goes on in the community that offers that mitigation or those protective factors for mental health have largely disappeared, right? So we've got a kind of duality of, over the last 15 years, the protective factors have been eroded through austerity, combined with quite a significant investment into mental illness, into mental health services, if you like. Now, you would think that the kind of investment into services would have improved the kind of capacity and access that people had. However, because we have seen this erosion of protective factors, we're not seeing the benefit of the investment that we've had into mental health, because people are still being driven into mental illness because their social circumstances are such that they are more likely to experience mental illness. So I think that we've got a bit of a kind of conflicting and painful reality, which is we know that we could prevent quite a lot of the mental illness that we've got going on in our services and our systems. But because of austerity and because of, you know, other factors and recent government decisions, those things are never really tackled. So we actually don't know how many people should experience mental health conditions in the UK if we had a kind of fully functioning public health, you know, a thriving environment. We would probably think there'd be about maybe 20 or 30% less people in mental health services. That's really significant when we think about it. So that I think is a problem. We haven't got a huge amount of investment into things that help people at the earliest opportunity. So often people end up in crisis before they get the help they need. So whilst we have open access to talking therapies, in some parts of the country, you could still be waiting for those for up to 2 years. So by the time you get to the end of the time, you're much more poorly than you might have been if you'd got the service earlier on. And then the counselling or the talking therapies don't work because they're not the intervention at that point that you need. So we've got a lot of contradicting factors. I would also say, and this is something that we at Mind are trying to tackle, but I think is a perpetual and frustrating truth, that we have such profound institutional racism in mental health broadly, in every organisation, every aspect of it, that one of the biggest scandals is that people from the global majority are still experience the worst outcomes and absolutely still experience the most acute end of the spectrum. And that is astonishing to me.
Yeah, we'll pick up on that, you know, because I want to look at the barriers to provision in different, harder to reach groups, if you like, including people from ethnic minority backgrounds. But I wanted to ask you now, when you were talking about austerity, Sarah, obviously, like provision across, like nationally, needs aren't uniform. So how do the local branches of Mind then connect nationally, and how do they work to meet the needs within individual areas?
Yeah, I mean, it's absolutely critical that they do. And that's why we very much keep this kind of federation approach, which allows local minds to really respond to local need, as opposed to me setting a very clear mandate for what should and shouldn't be delivered. And so we ask our local minds to be very much embedded in their local system. The majority of them are funded locally. we provide limited funding to organisations that are delivering particular programmes, but they are funded from their local systems. Their relationships are within their local systems. We've got, local minds across the country that are absolutely built into the pathways that people will experience for their mental health. If they need mild to moderate support, right up to residential crisis support, we've got minds, providing services across all of that spectrum, and they're tied in. Of course, what we're seeing in recent times is that becoming much harder, and harder because the way in which health and care decisions are made has changed, and so there is a real there is still quite a lot of chaos. Mental health still has to fight a battle for recognition. We don't get share of spend. All of that is still a fight, still today, and is set to be a bigger fight as we go forward. But I think that the local minds are much better informed about what their local community needs. And so we support them on all of those things. We have some national programmes that will say, look, we want you to be trauma informed. We want you to, and one of the things that we've recently said, all local minds must deliver on the patient carer race equality framework, which is making sure that their organisations are meeting the needs of globalised majority within their communities. So we have our intention is that local minds do their local business, but they have the weight of the national organisation behind them, so that we do the lobbying and the campaigning so that they can get on with delivery.
Okay, thank you for explaining that. It's really helpful to see how it works. And on the website, Sarah, it says that although 1 in 4 people have mental health issues, most of us don't get the help we need. There's a lot more awareness about mental health and well-being in public understanding in the media, in workplaces, which is great, but there are also barriers, and you've talked about some of these. So not everyone is getting the help they need, and I'd like to address this issue of barriers. So I'm from a South Asian background, and I know that some people from within these populations, there are a number of reasons that prevent them coming forward for support, including recognising that that they don't have issues, not recognising that they need help, so not conceptualising their behaviours or beliefs as being problematic. But another big issue is stigma. So increasing awareness has shifted some of these views, but they're still there. And I address this in the book that Jade talked about. So it was Journey to the Centre of the Self, where I was writing about kind of cultural mental health and the importance of placing culture at the centre of conversations. So can we start with the South Asian populations, or the global majority as a whole? What do you think can be done to help these groups of people, and why do you think they've had less than positive experiences with mental health services?
I mean, thank you. And again, great question. One of the things that I think is really interesting, we held our, very privileged to have had this, but we had a iftar last night with our colleagues from the Muslim community, and we have, deep relationships with Muslim community through the Muslim Mind Collective and other routes, and Islamic Relief, for instance. And we were talking about this very same issue, and there's a kind of couple of competing views really, which is, yes, there is a level of stigma within the communities themselves, that kind of either, that there is a lack of knowledge and understanding, or shame, etc. So absolutely some of those factors are true. But there is another view, and I suppose I would ascribe to this one particularly, which is that one of the reasons why people from the global majority have had such a poor experience is fundamentally because of discrimination and racism. And, when I think about it, and I think back to, throughout my career, it is probably only in recent years that I have seen a proper concerted effort from the entire system to make a difference to those communities. And you know, firstly, psychiatry is a very kind of white, heteronormative philosophy or framework, and that's the way it's designed and delivered. Services are still very much in that frame of mind, and one of the things we talked about last night, for instance, was, you know, in mental health, and as I say, 35 years I've been working in mental health. When I first started, there was a whole big view about, you know, what we mustn't talk about spirituality or religion. That mustn't come into it. But of course, for many of our communities, certainly for the Muslim community, you cannot separate them from that. So why would we provide a service that fundamentally excludes a primary core aspect of their very being? So there are so many factors around it, that discrimination, racism, these assumptions about psychiatry, which is very, you know, European, a very kind of a lack of, you know, we've used the hard to reach language for 30 years. That is such, I mean, we've banned that language from our organisation because it's not hard to reach. We're hard to reach. And that's the shift, fundamental shift that we have to make.
Yeah, that's really important, actually, that distinction of, it's, you know, it's not the groups, it's what we're not doing, isn't it? So can we move on to look at, say, men's mental health and how we can look at addressing some of the barriers there? I mean, I think there's increasingly there's kind of groups and push towards men talking about their mental health and emotional well-being, and especially younger men. But what do you think we can do to improve that as an area?
Gosh, I think, you know, look, I think our young men and our men are really vulnerable. And this is not to say women are. And, you know, look, I've spent a long time in women-only services, so I very much understand that experience. However, what I would say for boys and men, there are a number of factors. We still have not cracked it's okay for men to talk about their mental health. We haven't cracked that yet. So whilst we've had progress, that is still a really big issue. You know, I mean, I've been married for 32 years, right? And my husband is married to the chief executive of Mind, where it is absolutely okay to talk about your mental health. Does he do it? No, he doesn't. So we haven't cracked it, right? We haven't cracked it. We also are in a situation, and you know, I'm loath to talk about it, but it's really important, the radicalization of boys at the moment online in relation to that kind of hostility to the world. And if any of you are watching Adolescence at the moment on Netflix, I think that speaks to some of the worries that we have about our young boys who are being forced through all of this stuff to turn their emotional energy into rage and hostility, rather than what we want to see, which is engagement in health and support and all of the things that we've been talking about. We also know that men are most at risk of suicide, and the reason being is that it's not to say that they think about suicide more than women, but they are more likely to act on it. They are more likely to take a violent response to very emotional feelings. And these are the things, you know, even if it, you know, is towards themselves. So, you know, these are really big issues that we just haven't got to. We're also in a kind of situation where, you know, we're seeing unemployment and all of those factors around the economic crisis impact men more so. So the circumstances in which our men are having to exist right now isn't great. Right, there are all sorts of kind of pressure points. What can we do about it? Well, I think first and foremost, I think we need to make sure that we've got evidence or information that works. So again, it's the same thing as talking about the global majority. We've got to somehow make the choice to come for help possible, open and accessible, and that it doesn't lead to shame. And I think we've got quite a lot of work to do before we get to that point. We very much say, you know, our mantra is, if we can get men to literally reach out for the first time, that could make the biggest difference. But your point, Rina, is if they reach out and there's nothing there, then they don't reach out again. And so, you know, again, we've got to do a huge amount of work around that sense of, you know, how do we get our men to access support? If you don't get help the first time, keep coming back. And that's not easy to do.
Yeah, sure. I started the conversation by talking about the student population. So within the universities in the UK, we have seen an increase of support allocated to mental health services. But what do you think we can do to encourage young people? We talked about this a little bit with, you've addressed this by looking at young men, but young people in general, say the student population, to take up support if they need it. What do you think the barriers are maybe to students, and what can we do to help them?
Again, I mean, I think it's a matter of so there are a number of things. I think the transition into university needs some work. So thinking about what schools can do in preparation for that transition. I think we can't just land it on the university and hope for the best. I think that there's a whole pathway to managing transitions in life for a young person. So when you get to, you know, a situation where you've got a 17-year-old, you know, contemplating going to university, who's already experienced mental health challenges, often there is no kind of management of that transition or handover, so they just land up. So we've got that problem. There's not enough preparation. We then have a scenario whereby actually the universities don't have the resources. And this is where we have real tensions in the system. So we'll see it with police, we see it with, you know, anything community related, schools, university, because their primary business isn't mental health. However, they're on the front line of the mental health crisis. They don't have the resource, right? So I know universities will have one counsellor, hundreds and hundreds of kids or young people. I shouldn't say kids, but you know, I'm a mum. And you know that this frankly, I think is part of the issue. We haven't faced into actually what resources needed for our student population's mental health. I also think that we haven't faced into, and I think particularly now, and you mentioned it earlier on, the impact of the COVID pandemic. And it's set about now a culture in young people around engagement, around anxiety and stress that we're really struggling to shift and provide the right support for. I think we also make a lot of assumptions around young people and students that they're quite happy with digital lives and they want to stay in it and they're quite content there. Actually, when you ask young people, their digital lives are a part of it, but they want community. They actually want to be part of the community. They want to see people. They want to have friends. Loneliness is absolutely a key driver for our young people into mental illness. And those are the things we need to focus on. And my last point on it, we really need to help parents. One of the biggest interventions we could make, and this was one of the biggest, I guess, you know, in terms of austerity, what happened when things were taken away is parenting support and parenting programs. You know, like, again, I'm the chief executive of Mind, worked in mental health for a long time. I have 2 teenagers. It's still sometimes really hard to know what to do. It's really hard to know how to support your child and help them face all of the things that they've got to face in today's world. And so I think that parenting support would have, well, the evidence tells us if we could support parents, we'd have the biggest positive impact on children, young people's mental health.
Definitely. And I think what you said about transitions is vital, isn't it? Because the onus should not just be put on university. So if more work, preparatory work was done at schools to work with teachers who could then support parents then thinking about the journeys that what the progression into university or further education that students have, so thereby addressing it earlier would have a huge impact. And thinking about sort of use of screens or social media, then it's unrealistic to get young people to kind of stop that use, and it's a cultural difference with other generations. So how can we work with the change in culture, if you like, where young people spend a lot more time than say older generations on social media and using kind of mobile technologies? How can we work with these technologies and devices to reach them, and then reformulate kind of notions of community, whether online or in the real world? How can we do that?
Yeah, I think it's a really important challenge for us. So one of the things that I am really clear about is that the evidence that says social media is driving the mental illness in children and young people is not strong enough. So I think that we're in a fairly sorry, I just dropped my pen. I think we're in a fairly kind of unclear position in being able to say the rise in social media has equaled the rise in prevalence of mental illness in young people. However, I would say though that I think we're at that tipping point. So I do think, and it's not for the reasons that I think people might imagine, which is about self-image, etc. I think the risk of misinformation and that kind of radicalization is the problem. So that for me is the key issue around accessing social media for children and young people. We can't unwind the clock, and if we could just turn it off, wouldn't that be great? But actually, I don't think even if we did turn it off, that it would undo all of the stuff that's happened. However, I think that again, we've got to come back to basics. We've got to give young people a better offer. And so when we're eroding community, and you know, I live in a rural place now. I'm from North London, grew up in North London, proud Londoner, but moved out of London to Cambridge to have my children, and live in a little town, and there's nothing for them to do. You know, there's nowhere for them to go. There's no clubs. If they don't want to go to the cinema, or if they're not sporty, there's nothing for them to do. So what is the better offer to take them out of their bedrooms? And I'm afraid that's our responsibility. We as parents, we as educators, we as funders, and you know, our local authorities, we've got to rebuild our community for our children and young people, because otherwise there's nothing for them. And if we want to take them away from TikTok, we've got to find a better offer. And I'm telling you, because I know it to be true, that if we did, we would see young people come in droves, because I've seen it with my very eyes. You provide them a good offer, they're there, they want to do it, they want to be part of it. So there's that for me. I think that in relation to social media companies, we work really hard with them around making sure that that online safety is really clear. So we work with all of the industry leaders to say, and I remember I went to San Francisco myself in 2018 with Facebook and provided and persuaded them for the first time to put in their mental health safety tools. And I remember that conversation, sitting in a wonderfully interesting Silicon Valley type environment, and you know, having a really stark conversation about their responsibility. And I remember getting off the plane on the flight on the way home, receiving a notification from them that they'd agreed that they were going to implement those safety tools. So I think that all of that stuff is happening all of the time. And of course, all of the families that have been impacted through losing their children over the last few years have also had a really positive impact on social media companies. So there's that. We also have to enable our children to understand that it is us populating social media. So yes, there's lots of bots, and we've got to, that's the on there that drive some of this stuff. So how can we help each other act as better digital citizens, or whatever you want to call us? You know, we've got to take responsibility. If you know, I talk to my kids all the time about how they show up on social media, and not just because, you know, if they go for a job interview in 10 years time, it's not just that, but it's about the culture that they are creating, and they are contributing to that. So again, it's all of those factors, it's not just one of them.
Yeah, and it's about facilitation. So it's not, you know, we have to work together, really, is what the message you've been saying throughout. Okay, let's turn to look at the campaigns in mind. Can you talk a little bit about these, Sarah? And do you think they reflect the priorities we've been talking about?
Yeah, I mean, so our priorities as an organisation, we are focused on an equality, equity agenda, really. So we focus on people who are living in poverty. We focus on children, young people. We focus on those from racialised communities, and we focus on those people with the most serious mental health conditions. And as a result of that, our campaigns are all orientated towards those groups, trying to advocate primarily. So, for instance, we've done a lot of work around inpatient care, trying to improve the circumstances in which people find themselves. We've done a lot of work around crisis care. At the moment, we're obviously working on the benefits scenario, and we feel really strongly about that. And you will see, you just need to go across our social media channels at the moment, you'll see all of the stuff that we're putting out there about that. We're obviously challenging the culture war stuff around mental health and the stuff around overdiagnosis. We're challenging this notion of resilience, for instance. You know, so we say to individuals, you know, you need to be resilient. We speak to our young people. Can you just be a bit more resilient? It make everybody's life a bit more easier. Well, you can't really ask people to be resilient in circumstances that aren't resilient. You know, so it's like it just, you know, it's like saying to that chair in a burning building, don't burn as well, please. It's so wild to me. So I think we, again, try and bring it back to the system all the time. Yes, we want people to be resilient, and we want them to take care of their well-being, and we want them to be able to notice if they're becoming mentally ill. But we also need to stop driving people into mental illness. So we hold that view very, very strongly at Mind. And put it this way, we have had countless conversations with very important people over the last week, putting them in their place accordingly. Not sure that anybody really is taking note of it very much right now, but believe me, the fight for that justice is very much on.
So, this idea then you've been talking about, Sarah, about structural injustice, social injustice, that is very kind of integral, isn't it, to Mind, and whether in thinking about kind of in health, in work and law, and in an era that puts so much weight on the individual responsibility to mental health. I think what Mind does is to really say that, you know, they're kind of systemic issues that need to be addressed. So I guess that with all the information and resources out there, individuals do have a greater autonomy about their choices and how they manage stress, but we need to also acknowledge the inequalities in society, which means recognising structural and institutional injustice, and that's been, you know, something that is very loud and clear within Mind. Unless we kind of address these institutional structures, then, you know, we're not really going to get anywhere. So talking of institutions, then resources can only improve with funding. Moving on to thinking about what is the government doing in the current age, in the current times, to address mental health? I know it's a highly charged issue, but if you could give us an overview, that would be really helpful.
Oh, this is a really difficult one, and I'm really going to try hard not to swear, Rina. So I'm working hard at this. I'm holding strong. You know, I mean, so fundamentally, mental health utilises about 20% of healthcare performance, but is only funded at 10% to do so. So we've already got 10% underfunding across the NHS for just the baseline services, not for innovation, not for any of the kind of excellence that we want to see, just for baseline, right? Just for what's being delivered now. So that's quite extraordinary. Mental health has never had a share of spends that is based on parity of esteem or need or even demand, right? So ideally, we should be in a situation where it is funded for need. It's not even funded for demand. So we're already falling short. We also have, at this moment in time, a very odd scenario where, despite mental health being a key factor in productivity and people's absence from work and all of the stuff that the government's really concerned about, we have a real terms cut coming for mental health services. So one, we had to fight before Christmas for the mental health investment standard to make sure that you know, fundamentally mental health spending was going to be protected. But we know that we're just about to face, as a colleague said to me earlier on, it is almost like a bonfire of the vanities in a very kind of frightening way. And I don't quite know how we're going to make it work. I spoke to a trust chief executive very recently, providing mental health services, and her very words to me were, I've just received the first cut of the budget envelope, and I feel sick to my stomach because I know we will not be able to deliver services for our population in any way going forward. And that was stark. So funding is a real problem. I mean, obviously, funding for all health is a problem. Funding across public services is a problem. But our very clear view that's based on economic analysis, is based on evidence and really good, robust research, is that mental health is not the first place you should be going to withdraw support or funding for. And yet, I'm afraid that is where we are.
Yeah, very frustrating. And related to that, I mean, you talked earlier, Sarah, which is something about therapy, or, you know, people waiting for, say, talk therapy or counselling, and the timeliness of it, because if people are having to wait a long time, by the time they get access to the help they need, it might not be the actual thing that they need anymore. So if someone's in this situation where they're waiting for therapy of any sort, what do you think they can do in the meantime to keep themselves as mentally well as possible?
So I think, thank you for giving me the chance to say something about this, because I think it is important that we try and find ways of keeping people well while they wait. And so there are all sorts of resources. The Local Mind Network, you can go to your local mind, and often they don't have quite the same waiting lists, or they don't have the same referral criteria. Often people can self-refer, and I think all of that is important. We have loads of resources at Mind. So the first thing I always say to people is phone us, phone our information line, and we'll make sure that we get you to the right place. We'll get you the right information. We also have access to the Hub of Hope, which is the UK's best signposting tool to find out what's available in your area to you. So we can make sure that, you know, if there are support groups, that you'll find out about them. We'll get you the information. We also have an online peer support platform that currently has over 90,000 people supporting each other every single day with their mental health, which is I'm deeply proud of. We also have Supported Self-Help, which is an online referral program, which is a self-help program that takes you through various modules that helps you look after your mental health. So there are loads of things, but, you know, I mean, effectively, I would say this is phone us, phone our information line, and we'll help find the support for you. And I think people often don't understand the role of helplines, but I know, having spoken to my helpline staff and people that have used them, they can be the opening door to life-saving support. And just recently, our helpline saved somebody's life, and it was because they were able to get them the support they needed. So I think we need to get people through a door, and once we can get them through the door, we can try and find out what might be helpful. But of course, we also need to acknowledge that for many people, they will suffer in silence, and that is the struggle.
Yeah, absolutely. But it's great that there's that point of contact with, having a conversation with someone.
Yes.
In other cases, then, with the increase of digital health tools such as online therapy, for instance, or apps that are downloaded, while they they have their uses and they help reduce wait times for therapy, do you think? I mean, what are your views, Sarah, about the efficacy of online therapy as opposed to face-to-face? So it's really this question of thinking about whether there is much of a distinction between online or face-to-face, really, when it comes to therapy.
Well, I mean, I think, again, the evidence is really interesting, and it's evolving all the time, because it's still a fairly new, the pandemic certainly accelerated it. So at the moment, the research sort of tells us that, it's some people prefer online, some people don't. And that's not bound by age either, by the way. So, it's not, we can't just say young people prefer online. That's actually not the case. So it's very, very much based on individuals, what their experiences are and what their needs are. What do I think about the efficacy? I think that it's very complicated. I do think there's a lot of snake oil out there. So, just download. I mean, I saw one the other day and I literally thought, oh, dear God. It was basically an app that said, you can find out what type of PTSD that you've got, assuming that you have got it, and this is, what it will look like. And it was just appalling. And I could see all sorts of nonsense about it. So one of the things that we do at Mind is that we have partnered with Orca, which is a global body that manages the efficacy and the governance of digital healthcare tools. And we've got an online app library at Mind that you can also access. And the tools, the online resources that we've got on there are only on there because they've been scrutinised within an inch of their life. And we can prove to you that they've got efficacy, that they've got outcomes. So I feel really strongly that one of our roles as a national body is to be able to help people distinguish between snake oil and something that is actually going to make a difference. And also I think that we've got to, again, help decision makers not see digital healthcare as the knight in shining armor, because it's not going to save us. People save us. So I just kind of always try and make that point.
Yeah, and a very important point about making a distinction between what's helpful and what's been kind of rigorously researched and validated, and then the other, what as you call it, snake oil out there, which can be more damaging and then leads to people diagnosing themselves, doesn't it? And all these other things. There's so much of that, isn't there? Just we're running out of time, so just the last kind of main question. I understand that one of the ways you spend your downtime is with your animals, Sarah, and reading about that prompted me to ask you about the relationship between animals and mental health, which is, well established. So in my spare time, I'm a foster for the RSPCA, and I look after cats and kittens, which I really enjoy, and I find it kind of very therapeutic spending time, with the animals that come into my care, and believe that animals brings a whole new level of well-being, and it's often not discussed as much as it should be. So what are your thoughts about this?
Oh, Rina, well, firstly, thank you for your service to our country's animals, because you know what, I love that. Thank you. It's undeniable. I mean, look, if I could, right, I would prescribe dogs and cats to people who are lonely or who are isolated, who are vulnerable. You know, for young people learning about caretaking and love and all of those things. You know, animals are often the best way to do that learning, right? And I am under no illusion that my animals at home, and my husband laughs all the time, he says, you know, we've got far too many animals. I'd have many more if I could get away with it, but bring me such comfort and joy and space away, and you know, laughter. You know, because my animals are outrageously badly behaved, and so all of those things are, you know, bring such joy, and it is well evidenced. You know, we look at the evidence. In my last job, I was very honoured to have been asked to. We were funded unbelievably by the prison service to do a bit of research on dogs in prisons. And we were able to find, and you know, I'll send you the research, Rina, but we were able to find that dogs in prison had a direct positive impact on self-harm. So for those people who really experience self-harm, spending time with dogs reduced their self-harming behaviour. You can see in US prisons that the use of dogs and cats as a rehabilitation tool is very, very positive. So we've got a lot of evidence, you know, and I think, you know, the potential partnerships with the RSPCA and services, etc., are huge. And at some point, I am going to try and explore that. We've got one with a national trust because of that whole role of nature in preserving mental health. But yes, I mean, you know, there are people who think, you know, animals are a, you know, huge responsibility, and yes, they are. But in mental health terms, they are a gift. They are a gift to us, Rina.
Definitely. And I'm just curious, so what animals have you got then?
Oh, I've got cats, dogs, and a tortoise.
Okay. Yeah.
And my tortoise is only about 11 years old. But I always wanted one from being a child, so I got one for my birthday all those years ago. And you know, I've got you know, old cats, young cats, and oh gosh, I'm thinking about them now, and I haven't seen them for 24 hours, but I'm going home tonight, so I'll see them then, and I'll be ignored by quite a few for a few hours, but then they'll forgive me.
Yeah, they come round, don't they?
They come around eventually. Yeah.
Fantastic. Thank you for talking to me today. Before we hand over for questions, Sarah, I've asked you a number of questions, and I want to know, is there anything that we've not talked about that you'd like to address for a few minutes?
I mean, no, this has been a great conversation, Rina, and thank you. And it's, you know, special because you're from Hull University and I'm from Hull University, and that is really special for me, because even though, you know, I am a true Londoner, being in Hull, you know, during those years were some of the best years of my life, and I'm very proud to be an alumni of Hull.
We're delighted to have you, and you know, it'll be lovely to stay in touch. So thank you for today, Sarah. It's been fantastic, and I'll hand you over to Jade now, who's got will be able to field the questions. Thank you.
Thank you.
You're on mute, Jade, I think.
There we go. Thank you very much, Rina and Sarah, for this very insightful conversation. I hope it has been insightful for you know, our attendees as well. We've received a number of questions that I'd like to pose to you both for discussion. Let me read them out to you, and I might slot in one of my own if that's allowed. From Jenny Drew, who is in attendance. Jenny has asked two questions. One is going back to the claim on suicide amongst men, and you know, about those rates and fact checking them. As Jenny says, that her understanding from her work in mental health is that men are more likely to complete suicide attempts. where proportionally women are more likely to attempt suicide, and if that's correct. So women's suicide attempts are often dismissed as, not too seriously, often not
Yeah.
compared to men.
Yeah.
So is that true? And then another...
In a way, I think what we have is that the rates of self-harm in women are far greater, which skews the data around suicide versus self-harm versus what happens to men. So I think there is some element of truth that women are dismissed for suicidal feelings and behaviours. That is very true, linked to a particular diagnosis of personality disorder. So if you're a woman with personality disorder, you're basically written off on all sorts of levels, and it's that group of women that are more likely to die from suicide. So within that data piece, there's a lot of nuance, I think. So it's kind of all right, but the reality is that men are much more at risk of death by suicide than women are, just as you say, because they complete suicide. Women are more likely to have years and years and years of enduring suicidal behaviour and feelings, which is horrific.
Goodness me, very upsetting.
Yeah. Yeah.
Thank you for clarifying that.
Yeah.
Okay, another question we have from our audience. This one is from Diraj Shah. Diraj says that we often talk about the issue in the negative way, to intend to minimize the reality of current issues. He says there's a lot of initiatives out there to promote good physical health and well-being. And he'd like to ask, what initiatives are there out there to promote good mental health and well-being?
Yeah, well, absolutely. That's right, because what we want to be able to say to people, right, we've all got mental health. We're actually not all mentally ill. So it's trying to help people understand that, we've got to support our mental health in the same way as our physical health. So we do a huge amount of that at Mind. We have a physical activity program. So we are part of the Undefeatable. We work with Sport England. We work with the National Trust. All of those things to enable people to understand that you're looking after yourself physically will ultimately support your mental health, because we know that people with long-term physical health needs are more likely to develop a mental illness. So with all of that said, there's loads of stuff going on. Of course, it gets drowned out quite a bit, doesn't it? You're quite right. It does get drowned out from the kind of narrative of, things are terrible and, people are very poorly. So I think there's a lot more work that we probably could do at Mind, and a lot more of our partners could do. But certainly one of the criticisms of that too has been, and I think, I sort of sit on the fence with this one a bit, is that by talking about the well-being agenda and talking about that physical mental health link, we've somehow undermined the experience of more serious conditions. And so it's all a bit murky, actually, that the way we talk about well-being and physical health in relation to mental health. But the point is well made, I think, that you're inviting that challenge, that why aren't we quite doing it in the same way? And I recently used the example of prostate cancer. So about 2 weeks ago, there was a news segment on the BBC, which basically had a whole kind of raft of stuff about how brilliant it was that there'd been this awareness campaign for prostate cancer, and all of these men had come forward for tests, etc. But the same couldn't be said for mental health awareness campaign. So even if you've got a mental health awareness campaign and people do come forward, fundamentally that is still seen differently from the prostate cancer stuff. And the reason why is fundamentally stigma. There's just no other way of understanding that scenario. So this whole space, I think, about how we talk about what keeps you well, i.e. physical health, I think is really tricky, but one that we absolutely could do better at. That was around House's way of answering your question, but yeah.
Thank you, Sarah. Thank you very much. We have another question from the audience. What would you like to see happen first to start to make parity of esteem within mental health services a reality?
Well, I mean, sadly, we've already got quite a lot of the levers, right? So we've got the legislation, we've got the definition of what it should mean, but we haven't got any of the application. So I would just like us to apply what we've already agreed. So, you know, effectively, I'm not into any more grand gestures. Let's just get the basics right. Let's just make sure that there is an adequate share of spend in relation to parity of esteem. So that's part of the issue. You know, we've got all of the warm words, we've got all of the grounding there, but it is the real commitment to follow that through that's the problem. So I think that's what I would argue for is, you know, fundamentally, you've got to put your money where your mouth is, and that is literally it. And there are no other levers to turn at this stage.
A question for myself, if I may. You both discussed the role of technology in mental health, and I thought it was actually quite fascinating during the conversation how you said that, you know, we tend to think that the youth is more engaged with technology on mental health and in general than, you know, other ages, and that's not necessarily the case. So that's quite a great data point for us to be mindful of and aware of. And at the same time, you mentioned how, you know, it's people that help and save people. But I would still like to know, in this, you know, fast-moving digital world that we're living in today, what is Mind doing in specific on the technology side, possibly in engaging with users of the services? And, you know, there have been reports of people reporting positive impact of speaking to chatbots, for example, in certain circumstances. Obviously, I'm in no position to comment on that as it's not my field, but I have heard of this and read this. So I'd love to hear what Mind's doing on that front.
Yeah, so I mean, I think there's a couple of things. I go back to the making sure that we're able to find the quality stuff. So if you're going to use digital tools, we want to make sure that it's evidence-based. So our commitment to making sure that it's evidence-based through our app library and our relationship with Orca, which is a kind of quality-driven process, is our major commitment. We ourselves don't deliver digital services as Mind. Some of our local Minds do, but we don't. However, what I think I would say is that from the feedback that we've got, we definitely know that people with neurodiversity, for instance, work really well with online tools. So again, it's about what is the experience we're trying to respond to. So for instance, I have a diagnosis of ADHD, right? And I've had that diagnosis for about 10 years, obviously lived with it my whole life. I'm somebody who is much more likely to feel to use digital services, because actually I don't want to speak to a person because that's overwhelming. So I think it's about making sure that digital is person-centered versus this kind of mass idea that we'll just throw in a digital services for 18 to 25-year-olds. I don't want to see that. What I want to see is digital services that respond to need and are really kind of honing in on what that could look like. So one of the services that we know work really well is things like tracking mood, you know, getting pop-up reminders, being able to talk to a chatbot. You know, I use ChatGPT, for instance, you know, as my second brain. And whilst that isn't a mental health intervention, I absolutely know it helps me manage my mental health. So you know, I think that this is an evolving space. Mind is trying to kind of lead and be really kind of involved. But, you know, some of our providers are, you know, leaps and bounds ahead of us. So we've got a good partnership with Multiverse, which is Ewan Blair's, you know, platform around AI apprentices and all of that kind of stuff. And again, because we want to be digitally and, you know, we want to be fluent as an organisation. But I would say our quality mark around the Orca Library is our primary role.
Thank you. Thank you. Well, I'm looking at the clock, mindful of where we stand. We have just a few minutes left. And if I may pose a final question to both of you, you know, looking forward towards the future, could you please leave us with, you know, one thought on this topic? It's a big one.
Wow. It's a big one. You know what, I think from my perspective, it is very much trying to get folk not to listen too much to the kind of noise out there, do some proper reading around it, find some proper reputable sources, you know, mind our information resources are the best you will find in Europe. You know, try not to be caught up with the noise. I think it's try and come back to what does the evidence say? What are we saying at Mind? Because we're evidence-led. We don't do hyperbole. We're looking at the evidence all the time. So even if we come out with a very strong statement, it's evidence-based. So I guess that's my plea. Try not to get lost in the misinformation and the rubbish talk. Let's actually listen to what's going on for communities. Let's listen to people. Let's look at the evidence and let's follow that.
Thank you, Sarah. Rina, is there anything you'd like to leave us with?
I think it's about recognising the responsibility of all, so not just placing it on the individual. We do have, you know, to look after self-care, and, you know, we have a responsibility for ourselves, but we need to think about the fact that we're not all equal in terms of, you know, thinking about, say, structural racism and other issues like that, and work on those two things together. So bringing, you know, societal change and individual change, and also consistency is key. Sarah said earlier about no big kind of grand gestures. A lot of the stuff is out there, but it's just about maintaining the importance of consistency and finally destigmatization, because I think there's still too much stigma about mental health. And I think if people recognize that it's like blood pressure, we've all got blood pressure, because people talk about, you know, it's the same sort of thing. We all have mental health and it waxes and wanes, you know, but we're all a therapist used this idea of treading water a long time ago, and it really kind of stuck with me, because I think we're all treading water, and sometimes we need more help than at other times. So that would be kind of my final word on that.
Thank you both. It's been a wonderful conversation to experience and watch you both discuss these very imperative, important topics, and moving forward will remain to be so in our society. So thank you, Rina, for organizing and setting up this talk for the ICFS. And thank you very much, Sarah, for making yourself available, and also for the wonderful work you're doing with Mind. So we'll all be following that, I'm sure. This brings us to the close of our event. I'd like to share with all attendees in the audience that the web links to Mind and Professor Arya's book and the ICFS are all shared within the chat and on the slide that you can see now. And if there were any questions that you might have had that you weren't able to ask during the conversation, please email them over to us at hello@icfs.org.uk, and we'll ensure that they arrive at Rina and Sarah's post box to get back to you. So thank you very much. I'd say follow us on LinkedIn for future events, and we wish you a lovely day in the sunshine today. Goodbye, everyone.